So what does inflammation mean? Inflammation is how the body heals. So acute inflammation is necessary to heal. You bang your finger with a hammer, it gets red hot, swollen, and painful. That's because there's more blood going there and it's warmer and all that. It's sending in all of the necessary cells to clean up and start to repair and grow and everything. So that's necessary. You keep banging it with a hammer. Now, instead of trying to heal, it has to learn to protect itself from the chronic assault. So what am I going to get? I'm going to get a callus. It's going to get harder and harder. So I'm getting tissue proliferation, right? I'm making more of this. I'm going to get new blood vessels and all that, all the things to protect from the assault, not to heal. That's chronic inflammation. Well, think about that when you're thinking of a tumor. So a tumor it's chronically inflamed, and that means it's growing and it's getting new blood vessels and it's proliferating. That's part of the underlying. So really, you want to keep your inflammation down. Only you want it acutely when you injure yourself to heal, but you don't want to continually have it, because if you're continually having it, it means what? It means something is causing it. And for most of us, that's what we eat. What we eat is it's so critical. It determines the microorganisms that we have in our mouth, which determine whether or not we're going to have teeth when we get older. And they either produce what are called caries, which are called cavities on the surfaces of the tooth, or they go up under the gums and they cause what's called periodontal disease. They don't like the word disease, periodontal, and that's where you wind up losing the attachment of the tooth to the bone and you wind up losing a tooth. Right, so there's that. But we've also found that the microorganisms that are associated that are in the mouth are associated with specific systemic conditions, such as there are certain bacteria that are directly related to having a heart attack, other ones to having colon cancers, CFCs, and it varies. So it's like estimated to be around 80 to 90% of all systemic illnesses are due to began in and are related to the oral cavity. All right, so that has to do with what we're eating. All right, so if you change your diet, you're going to have a different biome in your different organisms. Why? Because if you have ants in your house, you have ants in your house because they found something to eat. You have cockroaches, they found something to eat. So wherever you see an organism, you know it found something to eat. That's why it's there. All right? So the microorganisms that would flourish on a fast food diet are not, when we have all of those microorganisms in us, we have what's called a dysbiosis. In other words, the balance of all the microorganisms is in they have relative proportions that of bacteria, microarchaea, funguses, all the other different microorganisms, protozoa, that do not support our immune function, do not support our the crosstalk between our brain and our gastrointestinal system, and all the other things, wound healing, blood clotting, all the things that these microorganisms do. So, but if you get a dysbiosis, you have the wrong proportions, and now you're not able to have the benefit because of why you have microorganisms. You're not gonna get the health effects of it, right? And then when it gets past the mouth and it goes into our gut, then we have a gut dysbiosis, right? And that is exceptionally important. For example, somebody's got ulcerative colitis, right? That is when their colon is got, it's got these patches of ulcers, and they have lots of diarrhea and abdominal pain and cramping, and the diarrhea's got mucus in it and blood, and it's a very terrible situation. You can eliminate that, resolve it by taking feces from someone who's healthy, and it's called a fecal transplant, and that changes it. That changes it. Right? That's how important they are. We have to realize, in fact, we're finding now that women that have breast CFCs have a specific type of dysbiosis that is similar and different than the people that have colon CFCs, and it's different than the people that have liver and lung, et cetera. So the relationship to the microorganisms in our health is profound, and they're only going to be wherever they get food. So if the microorganisms, it turns out that the right proportions of microorganisms that we need for absolute health turn out to be uncooked plant food. It's just the way it is. Think about this. Drive your car wherever you have to go to get to a jungle. You get to the jungle, step out of the car, take all your clothes off, put it in the car, and then push the car over a cliff. Go deep into the jungle and tell me what's for dinner. What are you equipped with to obtain nourishment? All right? Not getting a tool, a weapon. A dog doesn't need a weapon. Bear doesn't need a weapon. So what are we going to eat? I guess if you wanted to eat an animal of some sort, you'd have to be small, like I guess a lizard or a frog or maybe a bird. And I guess we would grab it and then choke it. But it'd be really like kind of hard to just take a bite and start eating it. However, if we saw fruit, if we saw certain plants that we could eat, we could pick them and eat them, and we're designed for that. We're designed for that. And if we like that one a lot, this plant, and I wanted to have more of it, I want to make sure I didn't run out, I could get the seeds and I could plant it. So my hands are designed for planting and plucking and that sort of thing. So it's just, I don't think there's any argument here. Are you going to argue about this? No, it's just the way it is. And then clinically, what have I seen? I'll tell you one story. This is a story with many, many lessons in it. But I had a woman, this was back in 2001 in New York. She came in June and she had breast CFCs, chronically fermenting cells, which is really what we call cancer. Because cancer is, as far as I'm concerned, it's a zodiac sign. You're born between June 20th and July 21st or whatever, June 21st and July 20th, whatever it is. In that time, you're Cancer. You're not Leo, and you're not Gemini, and you're not Capricorn, you're not Scorpio. Okay. That's what it is. Other than that, the word cancer has no meaning. It gives you incredible amounts of fear, so it conveys emotion, but not meaning. Okay. But the chronically fermenting cells is what they are. And if you understand what they are, then you can know how they got to be that way, and you can develop a strategy that will eliminate them. Yeah. So now I can work with that. And it also conveys no fear. Chronically fermenting cells, I don't go, oh my God, no. Okay. So anyway, this woman in June of 2001 came to my center in New York, and she had breast CFCs, and they'd gone all over the body, and she had so many in her armpit that she had this large ball of matted lymph nodes, and it was so painful she couldn't lift her arm and all that. So she came in and she told me that she already knows she's going to die. She was told maybe 6 months, and so she wanted to know if I could help her with just to get a little more mobility and decrease pain, so she could live a little easier. And so I talked to her about what we're talking about now, and explained to her what health was and all that sort of thing. And she said she got it. She goes, "Wow." So she goes, "Okay, I'm gonna do that because that'll work." And so she did. She said, "I don't even need any IV." She didn't want any IV vitamin C or anything. She just was going to do that. So I said, "Well, come in at least once a month. Let me see how you're doing." Said, okay. So she went away. She did fasting, cleansing, colon hydrotherapy, lymphatics. She learned to meditate, pray. She prayed and meditated, and she went to bed early, moved around all day, did all the things that we needs to be done. But she was eating uncooked food, only uncooked food, and then she would come in every month, and I saw her getting more and more mobility of her right arm. And then that was June I met her, and then I'd say by December she was like completely fine, feeling great, lots of energy, smiling, laughing, and all that. And then in January, 6 months later, she had a fatal automobile accident. And they did an autopsy. And on autopsy, they could find no CFCs. There was no longer any CFCs. So her husband and I, who'd come to know each other, were talking about it, and he was saying, although we're devastated because they had children, we're devastated. It's not as bad as it could have been, because these last 6 months she's been living and not dying. And then we were talking more, and we both came to the realization too that, the length of days on this planet is not up to us. It's the quality of the time. It's the way we live. So the last 6 months she was living and happy, and her relationships with her children, her spouse, and her family was beautiful. So the length of days is not up to us, it's the quality of it. And that was a very important realization. And then I realized, well, guess what? No one really has a contract for tomorrow. We're here today by the grace of God, and we'll be here tomorrow by the grace of God. So in that respect, we all have the same prognosis. And I saw that clearly multiple times where I'm working with a couple, and one of them has CFCs, the other one doesn't, and the one that doesn't dies first from an automobile accident or heart attack or something. We weren't even thinking about that person. So, that's important to realize. And well, and by the way, so okay, that's that's kind of the dietary thing. So yeah, there is absolutely. So that's what I saw. That's just one, and there's hundreds of other situations where if they ate that way, everything cleaned up, their biochemistry cleaned up. They were and they could heal. Now they can heal. But we had to get rid of toxins. There's certain steps you have to take to do this. But part of your getting rid of once you've eliminated the toxins and you continue to eliminate on a regular basis, then when you eat, you're going to eat food that's appropriate to your species. And what is that? That's uncooked plants. It just turns out to be that way. So that's that. Now, is there any other science to any of the other things we do, such as going to sleep early? Absolutely. We're diurnal creatures, not nocturnal. And so the minute the light starts to go down, it gets dimmer and dimmer. We have an enzyme that gets activated that turns, so you have there's an amino acid called tryptophan, which becomes serotonin in the daytime. And serotonin is the feel-good hormone and neurotransmitter and all that. As soon as it gets dark, one more enzyme is stimulated, and that turns it into melatonin. All right, so melatonin is nighttime, and melatonin does multiple things. Number one, it establishes the sleep cycle, so the sleep process. Secondly, it cleans up. It's one of the most potent scavengers of the hydroxyl free radical, so the antioxidant. And I think I can't say what's more important, but is it stimulates T cells, natural killer cells, macrophages, all the cells we need to have a strong immune system. That's what it does. Okay, so and we know that we have 90-minute sleep cycles, right? That's just the way it is. And we know that the sleep cycle, there's two kinds of sleep: restorative sleep, where you're restoring your body's chemistry and from the wear and tear of the day, and then there is dream sleep, which is called REM, rapid eye movement, and that's getting rid of all the regrets and sadness and all the things that are just in there, just letting them out. So it's kind of cleaning out the mind, and then the restorative sleep. So prior to around 1 a.m. is different for everybody. The majority of those 90-minute sleep cycles is restorative. After that point, the majority of that 90-minute sleep cycle is rapid eye movement sleep, dreams. So if you go to bed at 11 p.m. and you wake up at 7, you still had 8 hours of sleep, but you only got maybe one good cycle of restorative sleep instead of 6 or 4 or 5. And so you didn't restore completely, but you had plenty of dreams, so you don't hate everybody, but you didn't restore. So you still got some wear and tear from yesterday, and you do this again today and again today. Do it for a decade, you do it for 20 years. Okay, so anyway, we're designed to go to sleep early. Because when we do go to sleep early, because remember, right around 12 or 1 is when our hormone system kicks in. Our new biological day begins. We start producing prolactin and cortisol and things like that. Cortisol. Anyway, it's in cycles, and that's what establishes it. So, can we go to bed late? Yeah. Will we achieve optimal functioning? No. And we now know, we're looking at studies, that people that work the night shift have a much higher incidence of CFCs. What about movement? We know that movement is exceedingly important for everything. The metabolism, it's kind of the engines, get your engine started, right? Because your muscle movement and all that is going to stimulate the whole process of metabolism. And if it's slowed down, but it not only is delivering more oxygen and delivering more nutrients, it's also getting rid of wastes. When you're not doing that, you're turning a nice flowing river into a pond, and ponds are kind of funky. But more than that, we now know that strength, there's lots of studies on it. Your strength, your grip strength, correlate directly with your longevity and your ability to survive some sort of illness such as CFCs. Strength, okay, movement. I mean, there's 70 seconds of stair climbing. It increases your natural killer cells 6 times. So movement is absolutely essential. And think about what would we be doing if it was 7,000 years ago, right? Well, from the moment when we woke up in the morning, we'd be bending and lifting and walking, and we'd be active all day long. And what would we eat? Whatever we could acquire with these. And so that's sleep, and that's movement. The other one is meditation. Now, what we call meditation, some people that are like some Christians, some Mormons, some Jews, some Muslims, think that meditation is practicing another religion, and it's like praying to another God, and it's not. In fact, it's the opposite of prayer. Meditation is, if you think of prayer as talking to God, and you think of meditation as listening for the answer. So meditation is learning how to not think. And the reason we need to not think is because no matter what we're thinking, even if it's a beautiful thought, 80% of human thought subconsciously is negative. And negative thoughts directly suppress the immune system. We know that. The field of inquiry in this area is called psychoneuroimmunology. There's lots of papers on it. And the psychoneuroimmunology shows how fear, anger, regret, any of these deep sadness, these deep emotions, directly suppress natural killer cells, turn off the activated T cells, slow down the macrophages, just do all this, or dendritic cells directly. And we know that if someone is sitting there, and they've done studies, and they take people who've been meditating for a long time so they can quickly get to that condition where you're not thinking. And as soon as they do, they've got a catheter in their arm and they're checking their blood, and they find that their immune system goes right through the roof. It's powerful. And so this is called psychoneuroimmunology, psychology, neurology, the brain, and then immunology. So there's a pathway there. So there's science, there's a lot of science on that. So science on meditation, science on movement, science on sleep, science on eating healthy. And we also know that we balance systems. We need to balance the system. First of all, our gastrointestinal tracts are all messed up because we eat the wrong food in lots of amounts and too frequently. Well, not the wrong food, we eat food that's not really food anymore. So anyway, our gastrointestinal systems are all not working that well. But that needs to heal. Okay, there's methods of doing that. You have to heal that. A ton of science. I mean, balance the hormones. But I've got an estrogen receptor positive. Yeah, but estrogen is not bad, and the progesterone's good. There's no good and bad. Everything is necessary. What causes problems is when they get unbalanced. All right. So it's just like saying, what's better, day or night? What? Neither are better. They're both necessary. And so we don't look at hormones as being bad or good. We just look at them as being necessary, but they need to be in balance. And we're all out of balance because our environment, we have hormone disruptors. So we have to balance our hormones. We have to get our GI tract back into balance so it's able to function appropriately. And we have to balance our autonomic nervous system because our autonomic nervous system is different than our voluntary nervous system. Our voluntary nervous system says, I'm going to pick that up and I move. Okay. The involuntary nervous system is that part of our nervous system that's guiding and directing and digestion, heart rate, hormone secretion, all that stuff. The autonomic nervous system. And there's two branches to it: the sympathetic, which is, and this parasympathetic, which is healing. So we are in sympathetic overdrive because we live in unnatural lives. So we're always in sympathetic, which is antithetical to healing. Okay, because your blood's shunted away from your organs. You're not getting nutrition. You're not getting rid of the waste. It's going to the arm. You're not thinking because basically it's the fear response. So someone's walked in your door with a gun. You can't be saying, "Let me see now. Should I go over that?" You're dead. So you just need to react. Okay, so we shut off. We get sort of a temporary frontal lobotomy. We don't think. We just do. Also, we don't need our immune system so strongly at that moment, so that's shut down. So we just turn on what we need to. And so what that means is that if you're in sympathetic overdrive, in other words, you're pretty sympathetic all day long, you're not getting your parasympathetic, you're just not healing. You're not getting all that that healing, the blood flow. So we have to balance the autonomic nervous system. And then again, the mind. You got to learn to turn the mind off. So every one of those is founded on science, absolute science. Okay, now that's the lifestyle part. That's not talking about what else we do there. The interventions we do, such as intravenous vitamin C, is there science? Oh my gosh. Go to PubMed and put in intravenous vitamin C and I got to use that word, cancer. Okay, just put that in. And just see how many come out. But anyway, just I'll give you an idea. Beginning around 2000, I guess 6, 7, 8, Mark Levine, who was the lead investigator for the National Institute of Health, the NIH, well, that in coordination with the DEA and the National Cancer Institute and the NIH, they sponsored these studies, and they looked at studies, and they found out they were able to define that specifically how it is that certain levels of vitamin C in the blood will destroy CFCs. They defined it. After that, there was a clinical trial in, I think, University of Kansas with Julie Driscoll, looking at ovarian CFCs, and there's been other clinical trials now, and there's no question. And not only that, when you're getting in high doses, it's pro-oxidant, not antioxidant. Therefore, if you're also doing chemo, it's going to improve the kill of the chemo. So it's the opposite of what a lot of doctors think. They think it's an antioxidant. Well, it's only an antioxidant in low doses. Anyway, a lot of research. Ozone, a lot of research, and they've been using it in Europe for years, and Eastern Europe and Cuba, and I mean, yeah, ozone. Artesunate, wormwood, yeah, about 5,000 years of use in traditional Chinese medicine, Ayurvedic medicine, and now it got the 2015 Nobel Prize, and they found that it's 100% effective in malaria. Oh, but it's also effective in CFCs. So there's that, and there's curcumin. If you looked up curcumin and what it does, put curcumin in cancer, you'll see, wow. And all the things that it doesn't kill directly. It turns off all the mechanisms that have been turned on to produce CFCs. And it's like you'd say, well, if there was a drug that did this, it would be not $1 million seller, maybe $1 billion or $1 trillion. I mean, it does everything. It's unbelievable. Same with quercetin, and other botanicals that you can turn into intravenous formulas. And then, as I said, balancing the hormones, making sure that the metabolites of the hormones your body is producing, it doesn't get metabolized into a metabolite that is going to produce CFCs or something else, right? And so we look at that. And then if we find out that you're producing 4 hydroxyestrogens instead of 2 hydroxyestrogens, then we're going to there's very simple dietary modifications that correct it. How do you know that? Is there any science? Yes. At Johns Hopkins, they have a complete lab called the Brassica Lab. Brassica vegetables are broccoli, cauliflower, cabbage, bok choy, wasabi, Brussels sprouts, arugula. Though they have a chemical in them, but guess what? If you heat it up before you eat it, you won't get the benefit. Why? Because the benefit that comes from eating those is when an enzyme in one cell combines with a chemical in the other cell to produce a different chemical that is what we need. And you've heard of it, DIM, diethylmethane, you've heard of indole-3-carbinol, those kinds of glucosinolates that are produced. Okay, so you can't heat it up. Anyway, it's all science. Everything, it's all science.